All right, continuing about teaching about children and students with special needs. Previously, I talked about intellectual disability and giftedness and learning disorders. And now I'm going to talk about ADHD, which stands for Attention Deficit Hyperactivity Disorder. You don't have to have all of those things. You don't have to have hyperactivity necessarily to have this diagnosis, and it's one of the many things that has led to misunderstanding and misconceptions about this disorder. So, general definition first. All right, so ADHD involves potential problems in three main areas: inattention, difficulty paying attention, sustaining attention, being able to figure out what to pay attention to, impulsiveness, impulse control, being able to stop yourself from saying things, from doing things, and overactivity, being more active than is typical. Hyperactivity, overactivity, fidgeting, moving around all the time, having a very great deal of difficulty, basically not doing stuff. A lot of people, or I've met a lot of people that when they think of ADHD, they think of the hyperactivity part. Maybe because they met somebody who had the very obvious symptom of hyperactivity, and they remember that person because it was hard to talk to them because they were jumping all over the place, or it was a child who they were moving so much in their chair that it was distracting you because the chair was moving so much, and then the child wasn't hearing you because in addition to the chair making so much noise, they also have problems with attention. And so this is a descriptive category. With ADHD, you're just saying, okay, we've got a checklist of symptoms. Do you have enough of these symptoms? If you do, you get labeled with ADHD. Some people, when they find that like their child or a student or family member or themselves, they get diagnosed with ADHD and they're like, that's why I act that way. That's why my child acts that way. And the thing is, getting a diagnosis of ADHD tells you nothing about why you act that way. It simply tells you that you do indeed act that way, and we can check enough boxes off that we can say, you meet this category, this ADHD category, right? So just like all of our other diagnoses, this is descriptive. It describes the symptoms, but it doesn't explain where they come from, why they're there. And there are probably multiple pathways to the same set of symptoms. So there's no biological marker for ADHD. You can't do a brain scan and say, that kid's got ADHD. There may be some problems with brain regulation. And one thing about ADHD is it has a high degree of comorbidity. Comorbidity is when you overlap with other disorders. It's very common to have somebody who doesn't just have one disorder. In fact, I was talking to somebody recently. I was talking to a family member about another family member, saying, it's a family member who's deceased. And I said, the more I think about it, I wonder if they had ADHD, and they'll say, but they like, no, they had this other disorder. Don't you remember? I'm like, no, but you can have more than one. They're like, no, but they clearly had the other disorder. I'm like, yeah, but they can have that and ADHD. And I think it's just one of those things that may not be known, is that a lot of people have more than one diagnostic label that can be applied to them. ADHD overlaps with learning disorders, depression and anxiety, behavioral disorders. There are a lot of disorders that overlap with ADHD. So let's see. Issues with ADHD. First of all, there have been naming changes through the years, and so sometimes people will say, is that the same thing as ADD? Or some people will say, well, oh no, I don't have ADHD, I have ADD. Once upon a time, we had the category attention deficit disorder, without the H in there. And then you could have, at one point, you could have ADD with hyperactivity or without hyperactivity. And now we've got it all together with ADHD. It's like an umbrella category, whether you have the hyperactivity or not. So if you hear people say ADD, well, it's now called ADHD. It's been for a while. Other issues. Not everybody with ADHD looks the same. And so sometimes people will say, well, I don't think that person has ADHD. They look nothing like this other person I know who has ADHD. And people with ADHD often have difficulties with teachers and parents not recognizing their behaviors as ADHD. They will often be told things like, well, if you just tried harder. Oh, I don't understand why you can't just focus. A lot of time, a lot of individuals with ADHD will tell stories about getting the old, well, if you just apply yourself labels. And really, for many people with ADHD, their experience in school and the problems really show up when they start going to school, where you were expected to inhibit your impulses and sit in a chair and not move while you sit in that chair and pay attention to one and only one thing, which may not be the most interesting thing in the room. There are a lot of things about school that are very difficult for people with ADHD. And for someone who doesn't understand ADHD well, it's really easy to look at this student and be like, well, you're just not trying. You're just not trying, or you're just doing this to annoy me. Because sometimes, especially the hyperactive type behaviors, sometimes they can be perceived as annoying. Not always, but that some people do, especially if they value you sitting still in a chair. Also, the impulsivity, the impulse control issues. A lot of schools would like you to raise your hand and wait to be called upon. And when you have low impulse control, you will do things like just blurt things out. You will reach out and grab something without even realize that you're touching it. And people will interpret that as if you're being disrespectful, that you're not respecting the rules. And a lot of times the students are like, I wish I could follow these rules. I don't know how the other students are doing it. That's one thing I've heard from family members and students that I've worked with when I worked at a hospital. There were clients there that I would hear that same sort of description over and over again, like, I wish I knew how the other kids did it. Like, if I knew how to do those things, I would. If I knew how to sit still, I would sit still. If I knew how to figure out what to pay attention to and keep my attention on it, I would be there. I don't know how to do it. How do you people do that? All right, it's similar to when people with a learning disability like dyslexia, they're like, how are these other kids able to just know what these words say, even if they're not familiar with the word? How are they able to sound out these words? Why does that not happen for me? All right, so one issue with ADHD is people don't always recognize and respect their symptoms. Another issue with ADHD is some people will hear the symptoms of ADHD and they'll say, all right, poor attention, poor impulse control, overactivity. That sounds a lot like childhood. So what you psychology people did is you took normal childhood behavior and you slapped a diagnostic label on it, and now everybody's got ADHD, which is actually false. It's about, the numbers will change depending on which specific article or study. You look at around 5%, all right, less than 10% typically. So it's not that everybody has ADHD. The idea of it being normal childhood behavior. To get diagnosed with ADHD, you have to have atypical levels or atypical impairment from those behaviors. So you have to be more inattentive than other children your age. You have to be more hyperactive, more difficulties with attention, and it has to cause more problems for you. It has to impair with your functioning in some way. All right, so this is not the sort of thing where everybody could be diagnosed with ADHD. Other issues are sometimes people are misdiagnosed. I have heard people say things like, well, everybody is misdiagnosed. Nobody truly has ADHD. I think I've hopefully made it clear that is false. But one issue is there are some people who will be not misdiagnosed, and it kind of contributes to that narrative. Things like stress and depression for young children can manifest and anxiety can manifest in attention problems. A lot of the overactivity, impulsive stuff can be from other things other than, they can be explained with other categories, other labels. And so there is that issue that sometimes people are misdiagnosed. Another issue that kind of makes ADHD controversial is that very often it is treated with medication, and people really don't like giving medication to children for understandable reasons. The idea, hey, this person is still growing, do you know what you're giving them? Do you know that it's safe? All right, so first of all, with ADHD, successful treatment. Medication doesn't work for everybody with ADHD, but for people with ADHD, the majority respond well to medication, particularly stimulant medication like Ritalin, Adderall. There are other medications like Concerta, but these medications are stimulants, and so some people are like, the way you just described ADHD, I don't understand why you would hype them up with stimulants, but they don't react to stimulants as other people do. We think that the way stimulants are beneficial, and I'm not a neuropsychologist, I'm giving you the simple version. We think essentially that they stimulate the prefrontal cortex. Remember, we talked about the prefrontal cortex. What's the prefrontal cortex involved in? Anticipation, planning, impulse control, executive functioning. A lot of things that, yeah, you can see how the prefrontal cortex might be connected to ADHD. So we think that it probably stimulates the prefrontal cortex to start doing its thing. Medication alone is not the most effective treatment. For most individuals, the most effective treatment is a combination of medication and behavioral therapy, including parental education and therapy, getting parents involved. And some parents will get very offended. Like, what do you mean I need to come for therapy? You think I gave my child ADHD? You think their ADHD is my fault? And professionals will try to explain, no, not at all. But you're a central influence in your child's life, essential support. You're going to have to help them because medication, when medication is effective, it allows them to catch up. They can start learning skills like how to sit still in class, how to wait until you've been called upon to speak, how to not blurt out things, not interrupt people. You can learn those skills, but other people learned those skills years ago when they were younger. All right, so the medication essentially, to use oversimplified terminology, it kind of calms the brain down or calms the person down enough, focuses the person enough that they are now able to benefit from social skills, training, and education, things that a lot of people mastered earlier than them. So it's really good to have parents involved and say, okay, this is how you can help them learn these skills, master these skills that they haven't been able to work on because, they were not calm enough, they were not focused enough. And so there are certainly controversies with medication. Medications have side effects, all right? So I'm not going to pretend like that is not an issue. When medication is used effectively, it is very important that there be adequate follow-up, all right? You shouldn't just get a medication to be sent on your way. The optimal way to do things is have the child come back for frequent visits, and that's an issue of will insurance pay, but all right, come back for frequent visits where the doctor checks on things like, is it working? Does it seem to be beneficial? Are there side effects? How strong are the side effects? And sometimes they will need to change the dosage or the specific medication. Like they might change you from one type to another. Like, hey, let's try Concerta instead of Adderall or, something like that. So you have medication management visits that are very important when dealing with ADHD, particularly with children who are still growing. Let's see. Okay, another issue with ADHD. A lot of people don't like the fact that the numbers have been going up. More people are being diagnosed with ADHD. And so some people are like, okay, either you people are overdiagnosing or something about the environment is making more people have ADHD. All right. Well, this is an issue that's going to come up with autism too. We're getting there. That's the next video. We often forget that diagnosis depends on our labels and what counts, what is listed in the Diagnostic and Statistical Manual of Mental Disorders, the DSM. We often forget that the rules change because we learn things, we do more research, and we realize, oh, we need to update the diagnostic criteria for this disorder. Well, when we do that, we often make it so that more or less people will be diagnosed with a particular disorder. And so ADHD, the diagnostic criteria, have changed over time. And more people know about ADHD. It's much more common for educational professionals, mental health professionals, medical professionals, school professionals, community individuals. It's much more common for people to have heard about ADHD, to know, at least have a general idea of what it is, and to recognize the signs and symptoms. And so part of the reason that more people are getting diagnosed is their symptoms are getting recognized more often. It's not necessarily that there's more ADHD out in the world. There is more recognized ADHD out in the world. All right, folks, tell you about my family. All right, so I have one child with ADHD. I have family members. I have multiple family members with ADHD. People older than me in the family. All right, before my generation, all right, before my sibling was going in for assessment to see if they had ADHD, before my generation, all the stories are horrible, because it's just stories of my family members being allowed to fail in school. Oh, they got an F, I guess they're not trying. Oh, look at them, never applying themselves. And then they get older, and people, they have a family member like me who studies psychology. I'm like, you do know you have ADHD, and they talk to their doctor about it, and like, oh yeah, yes, you absolutely do. In some cases, oh, you didn't know that. The older generations in my family, there were members who had ADHD, but they just suffered. They had undiagnosed ADHD. They were allowed to get Fs, and they were blamed for a lot of their problems, their behavioral problems. They ended up functioning. They ended up finding a job that was a good fit for them. All right, but it's not that there's more ADHD. It's more accurate to say there is more recognized. There is more diagnosed ADHD, and diagnosis is a good thing, so you can have access to treatment. You can have access to accommodations in school. You can have access to sometimes special services and things. So that's more diagnosis. That's a good thing. Okay, so that's what I want my students to know about ADHD. And as I said, the next video is going to be about autism spectrum disorder.